the June issue of New Hampshire Magazine, where you can learn more about the work that has inspired this evening of recognition. It's my honor to be in the company of so many of our state's nurses as we celebrate the life-saving work and life-affirming care of these skilled professionals. We will be announcing the 2021 recipients of our Excellence in Nursing Award shortly. But first, let me acknowledge and thank the companies and organizations who are making this evening possible. Thank you to our event partner, the New Hampshire Nurses Association. Thank you to our presenting sponsor, Harvard Pilgrim Healthcare. Harvard Pilgrim and its family of companies provide health benefit plans, programs, and services to more than 3 million customers in New England and beyond. A leading not-for-profit health services company with a local office in Manchester and a staff that lives, works, and plays in New Hampshire. They guide their members and the communities they serve to better health. Founded by doctors nearly 50 years ago, Harvard Pilgrim is building on its legacy. In partnership with its expansive network of doctors and hospitals, Harvard Pilgrim is improving health outcomes and lowering costs through clinical quality and innovative care management. Our event sponsors, Dartmouth-Hitchcock Health. Dartmouth-Hitchcock Health is New Hampshire's only academic health system and the state's largest private employer. DHH serves a population of 1.9 million patients across northern New England and provides access to more than 1,800 providers in almost every area of medicine. Its flagship hospital, Dartmouth-Hitchcock Medical Center in Lebanon, New Hampshire, was named in 2020 as the #1 hospital in New Hampshire by US News and World Report, and recognized for high performance in 9 clinical specialties, procedures, and conditions. The Dartmouth-Hitchcock Health System includes the Norris Cotton Cancer Center, the Children's Hospital at Dartmouth-Hitchcock, 24 Dartmouth-Hitchcock clinics across New Hampshire and Vermont, as well as affiliated member hospitals in Lebanon, Keene, and New London, and Windsor, Vermont, and visiting nurse and hospice for Vermont and New Hampshire. We're also sponsored by Granite State College, a public nonprofit institution that is uniquely focused on the needs of working adult students in New Hampshire and beyond. Its affordable tuition, 100% online degree programs, and focus on workforce needs are among the top qualities that students appreciate. You can get started today in Granite State College's 100% online accredited and affordable BSN or MSN program at granite.edu. Riviera University in Nashua, New Hampshire is a leader in the education of nursing and healthcare professionals, a Catholic institution founded in 1933 by the Sisters of the Presentation of Mary. The university has a population of 2,200 undergraduate, professional studies, graduate and doctoral students in liberal arts and professional programs of study. The university offers regionally and nationally ranked nursing programs from the associate to the doctoral level, with a commitment to transforming hearts and minds to serve the world. Riviera proudly recognizes its nursing alumni on the front lines, protecting and serving our communities. Thanks to all of our sponsors and all those who have helped to make this event happen. And one of those people is standing by. I'm pleased to introduce Rick Broussard, the longtime and deservedly renowned editor of New Hampshire Magazine, who will be your host for tonight's celebration of the state's most excellent nurses. Rick.
Thanks, Ernesto. It does seem like nurses are finally getting due credit for the essential work they do for us all, on the front lines and often at great personal risk. And we're proud just to have a small part in raising awareness of the character and skill it takes to be an excellent nurse. And before we reveal this year's list, here's a word from someone who really understands the critical role played in our state and our world, really, by our community of nurses. And specifically here in New Hampshire, it's just a delight to interview Dr. William Brewster, Vice President of Harvard Pilgrim Healthcare. I got to talk to him earlier. Here are a few of his remarks to set the mood for this evening.
Dr. Brewster, you know, we've all been through a lot together over the last year or so, and I think that you're in a unique position to speak to how we're doing. I'm curious to get your thoughts on how's the state holding up, how are we, and how are we doing in our emergence from this year or so of crisis with COVID?
Yeah, so I think we've all become pretty expert at, reading the statistics, checking what's going on in the state. And so I don't think it'll be a surprise if I say that, we're seeing the cases of COVID come down, the deaths come down. We're certainly not at zero. We're not where we want to be. As a reflection myself on how I felt as a native New Hampshire person, I don't think I could be prouder of what we've done in the state, from the legislature to the governor, to all of our healthcare workers, citizens who are put up with an immense change in their lives, whether it's job stress or lack of jobs or whatever. But I think we've come a long way, and it feels like we're getting to where we start to see the light at the end of the tunnel. And that's in no small part related to also our healthcare workers who've just leaned in and done what needed to be done, even though that had to have been incredibly stressful.
Yeah, I can imagine. Healthcare is a profession we rely on so much and we take for granted so often. And I do think one thing that's come out of this is we don't take doctors and nurses for granted anymore. And I have to mention that I hear that you're considering a change of I guess life path right now. After 9 years heading up Harvard Pilgrim, and you've been in medicine since 1981. What's up with you?
Well, again, I love this job. I couldn't ask for a better job, and I'm uncomfortable walking away because I never feel like I'm old enough. But my wife, who's an ICU nurse and has taught me a lot of what I know about medical care, has basically told me that I need to retire. And the fact that I think the silver lining, I guess, of COVID for me is that I've been working from home. And I've found out that my wife can live with me 24/7, which is something that she is a nurse doing 12-hour shifts and me doing weekend calls and whatnot. There's been a lot of times we weren't together. So the silver lining is she still wants me to retire, even though we've been together 24/7 for the last year and a half or so.
Well, sounds like you got your hands full in your retirement.
Yeah, well, I'm really excited about retiring. I also have 2 kids. One that is in med school in Maine, and my daughter who's in healthcare, who's in Nottingham but works in New Hampshire. And I have 2 amazingly cute and brilliant grandchildren, and I'm teaching them how to fish. So that's one of the things that's tops on my list is spending time with the family and teaching my grandkids how to fish.
Well, it's always a pleasure to have you at any of our events, but I hear you might have some comments that you specifically prepared for tonight. If you'd like to share those, I'd love to hear them.
Yeah. Oh, absolutely. Well, again, thank you everybody for allowing me to be part of this event. As some of you may know, because you've heard me before, but others who haven't, I'm the vice president responsible for Harvard Pilgrim in New Hampshire. I'm also an internal medicine doc. I've not been seeing patients for the last 3 years or so, but have been there, done that. And I have to tell you that the people that I've seen getting the awards have truly earned them. It's the best of the best in New Hampshire. And again, just being able to recognize people for what you do every day. Again, it's an honor to be here and thanks for coming. I have to tell you, for people who may not know, who are outside of healthcare, it's not all glorious. It's every day is different. And a patient that you get sign out at 8 in the morning or 7 in the morning, that's supposedly the healthiest person on the floor, often turns out to not be that way. They tend to be surprising. And yet, the nurses just go in every day taking care of sicker and sicker patients. I mean, things have changed so that people get surgery and they leave almost immediately. The patients that are there are very sick. And then you throw in COVID. The sacrifice you've all done this year in particular, but what you do every day and have done and will do is truly amazing. And again, I just have to, on behalf of Harvard Pilgrim, on behalf of my family and other healthcare workers, as well as the state of New Hampshire, I just have to thank you for being there, doing all that you've done. And again, I have to say also that as a New Hampshire native, I'm not surprised that all of you do what you do. It's what we've done. I am always comfortable getting healthcare, as much as I don't like being a patient. Getting healthcare in New Hampshire is just incredible. It's an incredible place to live, work, but also get healthcare. So again, I'm on behalf of Harvard Pilgrim, on behalf of the state, those of you getting the award tonight and other nurses who also do great work, I just have to say thank you so much for what you do. And again, it's been an honor to be part of these over the last few years.
Well, thank you for that. And thank you for all you've done also, Dr. Brewster, and enjoy fishing with your grandkids.
I will. Thank you so much. I really appreciate it. And again, thanks to all of you that are getting the awards tonight. Great job.
We've worked with Dr. Brewster for years, and we're really going to miss him. It's now my pleasure to introduce Dr. Amy Matthews, Chief Nursing Officer at Cheshire Medical Center, Dartmouth, Hitchcock, and Keene, and Treasurer of the New Hampshire Nurses Association. Dr. Matthews will be introducing this year's winners and allowing the meets a chance to just say a few words.
Good evening. Welcome to the celebration of nursing and New Hampshire nurses who embody excellence in nursing practice. On behalf of the New Hampshire Nurses Association, I want to thank New Hampshire Magazine and our presenting partner, Harvard Pilgrim Health, for this opportunity to recognize New Hampshire nurses tonight. Thank you to the sponsoring organizations, Dartmouth Hitchcock Health, Riviera University, and Granite State College for their ongoing support. Thank you also to the nurses and their colleagues who dedicated time to nominate deserving nurses, to score nominations, and to raise up these nurse role models. I am honored to be a part of this wonderful celebration. Personally, I have practiced nursing for 36 years, and what I found most meaningful was my connection to patients, families, and my colleagues. I was able to see some of the most vulnerable, joyous, frightening, and even humorous moments in their own life's journey. That is a gift for which I owe a debt of gratitude. I'm further from that point of care now, and in my role as a chief nurse and a member of the New Hampshire Nurses Association board, I have the privilege of witnessing the professionalism, compassion, knowledge, and dedication of nurses across our state. Perhaps most importantly, I see their ability and their willingness to take action that changes outcomes for patients, communities, and reaches beyond our borders. Tonight, we will honor extraordinary nurses. These nurses represent care across 13 different specialties within nursing. Recognizing their accomplishments in varied areas of practice demonstrates nurse. This chance to highlight excellence in diverse practice is timely. On May 11th, the National Academy of Medicine released the Future of Nursing 2020-2030 report, charting a path to achieve health equity. This report calls out the pivotal role of nearly 4 million US nurses. The authors note that nurses are the first and most frequent line of contact with people of all backgrounds and all experiences seeking healthcare. The report outlines a vision to achieve health equity built on strengthening nursing capacity and expertise. It acknowledges the major role of the nursing profession to engage in the complex work of aligning public health, healthcare, social service, and public policies to eliminate health disparities and achieve health equity. The nurses we honor tonight are professionals who make a difference every day. They serve as expert role models and as change agents. They lead us to improve care and eliminate health disparities. We are fortunate that they choose to practice here in New Hampshire. Please join me in congratulating each 2021 award recipient as we celebrate them. First up is the award for Advanced Practice Registered Nurse, and the Nursing Excellence Award goes to Jillian Belmont of Dartmouth Hitchcock Medical Center.
Hi, good evening, everyone. Thank you so much for the introduction. I am beyond grateful and overwhelmed with the congratulations and the thought that went into the nomination. I wouldn't be able to do my job without all of my colleagues who are also inspiring to have me do my best every day. The nurses that surround me, my nurse practitioner colleagues, my physician colleagues, the support staff, our rehabilitation colleagues, and certainly our patients and their families. And of course, my own family who supports me outside of work. And really, I'm proud to be a nurse practitioner. I'm proud to work where I am, and I wouldn't be able to do it with everybody surrounding me and supporting. So congratulations to everyone else on their awards tonight. And thank you everybody for joining us tonight and celebrating all of these wonderful nurses. Thank you.
In the specialty of ambulatory care nursing, we congratulate Lisa Wesinger of Dartmouth Hitchcock Medical Center and Norris Cotton Cancer Center.
Thank you, everyone, for having me here tonight. It's an honor to be here amongst these amazing New Hampshire nurses. Thanks so much to my friends and colleagues who nominated me for this award, Ivy Park, Judy Gentes, and Crystal Smart. I'm a second career nurse who feels fortunate to have found my passion for oncology nursing early on. For over 20 years, I worked at the bedside and now as a nurse navigator, primarily caring for patients and their families undergoing stem cell transplant. I thank God every day for the courageous patients I've had the honor to care for. Thanks to all the nurses and senior practicum students I have mentored over the years. Their curiosity and drive kept me on my toes and pushed me to stay on top of my game. Thanks to my incredible nurse leadership mentors, Marilyn Bedell, Dr. Jean Coffey, and Dr. Elizabeth McGrath. Thanks to my friends and colleagues in the DHMC Cancer Support Services and DH Creative Arts for not only providing the arts to our patients, but for helping me with the inpatient permanent art display, The Walls of Hope. Thanks to my friends of the Norris Cotton Cancer Center and the Proudy who have inspired me to push Team Hope to our ultimate fundraising goal of $100,000 in a pandemic. And especially thank you to our DHMC BMT hematology team. Our team of nurses and doctors have worked together for many years. We're a family. They're an exceptional group of compassionate providers, and I'm so lucky to be a part of this incredible team. And lastly, thanks to my 4 beautiful sisters, 3 of which are here today, my husband Wayne, my daughters Maria and Gabby, who have supported my many endeavors over the years. And thanks to my little dog Frankie for our long walks that enable me to tap into my creative mind and come up with some new ideas to improve the lives of our patients. I am so honored for this award, and thank you, New Hampshire Magazine.
The award for excellence in cardiovascular nursing goes to John Flynn of the Heart and Vascular Center at Dartmouth-Hitchcock Medical Center.
Okay. Thank you to New Hampshire Nursing Magazine and to the New Hampshire Nurses Association for this honor. And thank you, everybody in the broadcast. Thank you very much. I'm humbled that I was nominated by my team here at Cardiovascular Center, and I was selected to receive this award. I'd like to thank just Dr. Krieger and Dr. DeVries. They're head of our program. They're really supportive to me. And Dr. John Robb, for years, taught me a lot about cardiology. And with my support of Dave, my supervisor, my family, my wife, Jenny, and my family, thank you. The great Mr. Rogers once said there's 3 ways to ultimate success. The first way is to be kind, and the second way is to be kind, and the third way is to be kind. And I found in my career that the easiest way to get the success is to follow more of Mr. Rogers, which is it helps to have people who we love beside us when we have to do difficult things in life. My team here at this hospital is both kind and is who I want beside me for all that we've been through. The truth is really I'm here honored today, but behind me, the Cardiovascular Center are really the people who allow me to shine and who allow me to come here and be part of the healing and the miracles for our patients. And knowing that they have my back and I have theirs. So each day this year, we've left our families behind and become one family at all our workplaces. Each day we've saved lives, and that's given us life to help each other, knowing that we're following, all of us here today, our true calling. And each day we're surrounded by good people and are better for being with all those people we've had this year in New Hampshire. Sometimes we've had some bad days this year. We all have. And it's days that we've given everything, and it hasn't worked out. These are the days that we've needed each other here most in the last year, the days when we didn't blame but tried to understand each other throughout all this pandemic, the days when we didn't point fingers but used our hands to help each other, and the days when we learned together and embraced and even forgiven each other as we've tried to work through some major challenges. These are the days that made us stronger in the last year, especially at the Heart and Vascular Center. Receiving this award this year is during a pandemic is really bittersweet. It's a year we were all pushed to our limits, and now we know that we can be pushed much harder. We saw a patient needing us more than ever, and Now we know that we have to be there for our patients in ways when their families could not even be with them. And it was a year when teamwork took on a new meaning at Dartmouth-Hitchcock, and we rose to that challenge. Again, you all know that it was a year of great suffering for our profession and throughout the nation, which forced us into a time of great reflection and appreciation for what we have. I know what I have here at Dartmouth-Hitchcock, and the cath team at the Heart and Vascular Center is second to none. For them to look at me as a leader is one of the most important accomplishments in my life. And I am here because, as a nurse, because of the support they've given me through, more than a decade. So our secret sauce really at the Cardiovascular Center is, values of honesty, dedication, accountability, determination. These aren't just words, but they're our lifeblood to the whole team. And every day, as a team, we turn these words into action every minute and each day, both for our patients and most importantly for each other. I'm able to be a leader on this team because they support me. They allow me the freedom and the space to lead. And this is why we are a family, and we are really great at cardiology at Dartmouth-Hitchcock. This is why my whole department deserves this award, and I share it with them. And really, they are my heroes. I've watched their dedication for the last year, and I just get to make this speech. So thank you, everyone. And thank you. Congratulations, everybody that got the award this year. Thank you.
For excellence in emergency nursing, we honor Janet Carroll of Dartmouth-Hitchcock Medical Center and the New Hampshire Coalition Against Domestic and Sexual Violence.
Hi there. Good morning, good evening, everybody. It's very humbling to receive this award. It seems a little bittersweet just because I know that many of our emergency nurses, they've been on the front lines every day. And they've been doing such a good job. And I know that I wouldn't be here if I didn't have the support of my employers. I am lucky enough to work at Dartmouth-Hitchcock, where I have incredible support that allows our program to continue to expand and to provide really comprehensive, compassionate care to everybody. It's really incredible to work at Dartmouth-Hitchcock. And of course, I also wouldn't be here without my my statewide SANE folks. I also work at the New Hampshire Coalition Against Domestic and Sexual Violence, and they really plow the way for sexual assault nurse examiners throughout the state. And I just wish that all programs were as lucky as I am at Hitchcock. We have an incredible group of nurses. Right now we have 9 of us. They all work full-time jobs above and beyond. And I am humbled every day that I'm able to work with them. It's incredible. I want to thank everybody. I obviously didn't make any type of speech whatsoever. I was nominated by our risk management department, and a lot of people would say, wow, that's interesting. They always have my back. They always have my back. I have them on text message, and I certainly couldn't do it without them. So I want to thank everyone who's supported us along the way, let us expand, and hopefully that trickles throughout the state. And I just want to thank everyone, and congratulations to everybody here tonight, because everyone deserves it so much. Thank you.
Next, for her work as a frontline administrative nursing leader, the honor goes to Judith Joy of New Hampshire COVID Alliance. Judy, we really want to hear from you. Can you turn on your camera? Well, you know, it's been a year of doing these sort of things. This happens.
Have you been able to hear me up till now? Are you able to hear me?
Start. We're able to hear you now. Would love to hear what you have to say.
Okay, were you able to hear anything I said before?
Oh, unfortunately, no. Please go ahead.
Okay, thank you. Thank you. Let me start again, and I'm sorry that we've had a little technical problem here. So when I asked about the time I have to speak, which was probably a little bit less time than I'm going to take, I was told about 2 minutes, and that's sort of enough time to thank my parents, my hairdresser, and so forth, rather like the Oscars. Although I'm grateful for those people in my life, for this I'm most thankful for the colleagueship of the group who nominated me, the COVID Alliance Senior Support Team, the SST. Over the past year, this 100% volunteer group was available 7 days a week to listen to, and support contacts at New Hampshire elder care facilities to assist in their management of the pandemic. It encouraged me that many of the SST volunteers were nurses, exemplifying the very best in our profession, but many were not. Just like nursing today, working in teams with many different perspectives has been among the most rewarding part of this experience for me. In a society that often underappreciates elders as a resource, it was also gratifying to tap that pool. Many of our volunteers were of an age, and volunteering safely was an issue. Since we operated remotely, we offered a safe way to contribute. Older volunteers can and should be the foundation for any future emergency effort. Bear with me while I explain why the SST was needed during this past year. After all, CDC, CMS, DHHS, and every other alphabet you can think of were issuing guidelines. Why were we even needed? At least 2 reasons. The first, financial. Healthcare and government cannot be sufficiently staffed for a pandemic without wasted dollars and manpower. The second, agencies and governments make guidance available, reams of it, but it is not their primary role to listen. We did, and we believe it made a difference, even when there was no action we could take to help. That is the best of nursing, whether it was a nurse who did it or not. Although there are many on this incredible team who should be named, and I hope they will forgive me if I don't, I would like to specifically acknowledge the work of Daniel Curtis, Executive Director, and Chairman, Senator Tom Sherman, MD. The commitment demonstrated by both of these men to New Hampshire's elderly, this project, and me was extraordinary. And one more, I'd like to thank Kate, who is my biggest supporter and most of the time forgives me for being her bossy older sister. Thank you.
In the specialty of hospice palliative care nursing and/or gerontologic nursing, the award goes to Catherine Oliver, Nurse Manager for the Community Living Center of the Manchester VA Medical Center.
Hi. I want to thank everybody for this award. It was amazing. Thank you. I would first like to thank Tamara Yazinski for taking the time to nominate me. I work at the Manchester VA, and I've been there for over 20 years, 23 almost to be exact. I have worked on the same unit. I love caring for the veterans. But Manchester VA makes my job easy every day, from the support that I get from my nurse exec, Jen Winslow, the director, Kevin Forrest, to everybody on my team. We run an amazing community living center in palliative care unit, caring for the men and women who have served our country, and I am very proud of that. So is my whole team, and it shows giving excellent care to the veterans of New Hampshire. Thank you.
Next, for excellence in maternal child health nursing, we award Jamie Cutter of Granite VNA.
Hi there. I want to say thank you to everybody for nominating me for the New Hampshire Nurses Association and the New Hampshire Magazine Maternal Child Health Excellence in Nursing Award. I love my job. I love caring for women and children and have devoted my career to that. So it truly is an honor to be nominated for this, and I greatly appreciate being the recipient. Thank you.
And now for the specialty of medical surgical nursing, our winner is Erin St. Gelais of Wentworth Douglas Hospital.
Hello, everybody. Congratulations to all the other nurses here tonight. I'd like to start by saying thank you to the New Hampshire Nurses Association and New Hampshire Magazine for really celebrating nurses and recognizing our importance and accomplishments this past year. There are truly so many deserving frontline nurses of this award. I'm honored to receive it on behalf of all of them tonight. I'm fortunate to work in a healthcare system at Wentworth Douglas Hospital that has the absolute best people. My coworkers are supportive. They're my leaders, my mentors, and those relationships have definitely been critical to my success. So I'll start by saying thank you to my PACU family. Having a nurse in the family in any capacity, a mom, a wife, a daughter, it's never easy. Long hours, unexpected shifts, holidays. It's a lot. So thank you to my family for understanding my commitment to this job. And lastly, to the community, it's been my greatest pleasure getting to know you and care for you and your loved ones. You are truly why we do what we do. So thank you.
Our honoree in the specialty of nurse educator, nurse researcher is Jennifer Pletcher of Concord Hospital.
Hello, thank you everyone. I wanted to thank New Hampshire Magazine and the New Hampshire Nurses Association for this award. I also wanted to dedicate this award to my dad, who just recently passed away. He was probably the first to teach me about empathy and was probably the spark that drove me to later talk about or think about trauma-informed care and research. I also want to thank the team of professionals that I work with in the emergency department. You guys are amazing. Through this year, we've managed so many shifts, changes, bumps. Everything's come our way this year. And because of that, I have needed to be more creative with how we educate our new staff, educate our current staff on new policies or procedures. And you have allowed me to explore some creative options, and I appreciate you nominating me for this award. I also wanted to thank my fiance and my 2 young children who are ever supportive in my research efforts and my continued education. So thank you to everyone, and thank you, congratulations to everyone who is also receiving an award.
The winner of the Excellence Award for Pediatric and School Nursing is Jennifer Kruger of Elliott Hospital. All right, I'm sorry. It looks like we may have lost connection with Jennifer. They'll see if we can get back to her. So let's move on. And in the specialty of psychiatric and mental health nursing, we award Evie Stacy, Dartmouth Hitchcock Clinic. Okay, unfortunately, we're going to move on again, or fortunately, because next, for excellence in public health nursing, it is an honor to recognize Polly Campion, a former state legislator and chair of the New Hampshire State Commission on Aging.
Good evening. And what's been happening is just emblematic of this entire year. How many Zoom meetings have we had in which there have been technical difficulties? So hopefully we can get back to the other awardees. What an impressive set of nurses. Congratulations to all of you for being recognized for the remarkable contributions that you have each made. As others have said, I too was very surprised to have been named as a recipient of this award. And a special thank you to Susan Smith for your nomination. I understand that you were somewhat stymied in selecting the most appropriate category of nursing within which to submit my nomination. As Joan Widmer has said about my career, it sort of defies the existing award categories. So thanks for going ahead with it anyway. In fact, one of the things that I love most about nursing is the ability to work in a broad range of roles and settings, each of which relies on the core aspects of what it means to be a nurse. For me, the role of advocate has always been central, whether that involves advocating for an individual patient, a family, a group of patients, or a community. During the past year plus, all nurses have been challenged to provide care and to advocate in new and creative ways, and sometimes in heartbreaking circumstances. And you have stepped up. Thank you for all that you have done and continue to do. Over the past 35 years, each time I have taken a turn in my nursing career, it has in part been triggered by one or more nurses or those working with nurses who have acted as mentors. And I'd like to thank a few of those individuals very briefly. I could go through a very much longer list, but I'll try to keep it short. Marilyn Bedell has been mentioned already. She was a classmate of mine at Colby Sawyer while serving as the nurse manager of inpatient oncology at what was at that point Mary Hitchcock Memorial Hospital. She invited me into the care of hem-onc and bone marrow transplant patients, such that I turned toward that practice arena over my original plan to work in women's health. Susan Reeves, a colleague and administrative fellow at the time, thought I might be a good fit for a nursing quality improvement role, and that led to progressive administrative roles over the following 19 years. Gina Baucus of the Home Care Association asked me to facilitate a group for a nursing quality improvement role, of home care leaders that led to my teaching a class for the next 3 years. The wonderful Lori Harding was the first person I spoke with about running for office. Judy Joy thought I might want to join the NHNA Commission on Government Affairs. Pam DiNapoli and Joan Widmer have been enormous supporters as I worked on my way through how to connect the legislature with the role of nurses as advocates. And more recently, Paula McKinnon was instrumental in getting me involved in the COVID-19 senior support team with its focus on long-term care residents. And I'd just like to end by encouraging all nurses, excellent nurses, all, to raise your voices because nurses' voices count. And finally, I'd just like to thank New Hampshire Magazine and NHNA for highlighting the importance of nursing, particularly during this trying year. Thank you.
Nicely.
Category of Senior Nurse Leader. Our winner is Margaret Georgia of Dartmouth Hitchcock Medical Center.
Good evening, everybody. I want to thank New Hampshire Magazine and the NHNA for this incredible honor. I'm so humbled. I would also like to thank my Dartmouth Hitchcock Care Management team, including Dr. Elias Lucas, who's my medical director, for this nomination. I couldn't do my job without them. They are absolutely my work family. My Chief Nursing Officer, Karen Clements, for all her support, because we couldn't do this without her. So I am truly humbled by this award. Congratulations to all of the other award recipients, and thank you very much.
Congratulations and best wishes to our 2021 recipients.
Thanks, Amy. Good job. And thanks for putting up with our technical difficulties, as was stated. That does seem to be a nice way to summarize the past year. Congratulations. I would love to offer the congratulations and gratitude of really the entire state to our Nursing Excellence honorees for the work you do. So those are our awards for excellence in nursing for the past year. It's been a remarkably challenging year for healthcare providers, but with nurses like these on the job, we're all a lot safer and healthier. So thanks to each one of you for the dedication, the work, the heart and the soul that's required to be a truly excellent nurse. And thanks again to our sponsors, Harvard Pilgrim Healthcare, Dartmouth Hitchcock Health, Granite State College, and Riviera University, and a personal thank you to the board of the New Hampshire Nurses Association, who eagerly partnered with New Hampshire Magazine when we first conceived this award, and who have been the driving force behind it ever since. And speaking of New Hampshire Magazine, the stories on all these excellent nurses appear, and some on our frontline emergency room nurses, just because there's so many stories to tell, are in the June issue of New Hampshire Magazine, which is on its way to subscribers now and should be on the newsstand by the beginning of next month. And so with that, good night and good health.